So most recently, I was referred a young man in college who has a life-threatening autoimmune vasculitis. So he almost died from this. And this was where his immune system was attacking his blood vessels and causing bleeding to occur at different places in his body. And he actually suffered some pretty bad damage in his lungs from this and in his esophagus. And he had bad reactions to the immunosuppressant drugs that he was placed on, and had actually kind of run through a litany of these unsuccessfully. One of them caused, again, like a disabling colitis in him, and so he had to stop that one. Another one caused his hair to fall out, and he was just this beautiful, good-looking young man in college. That was extremely distressing for him, of course. And so he was on prednisone when he saw me, and just honestly petrified about the condition getting worse, not really being given the option of staying on prednisone long term. He was afraid of the prednisone side effects. He was afraid of having to try yet another immunosuppressant drug. So it was a very difficult situation, and he'd seen multiple specialists for this. So when I saw him, I immediately balanced his hormones to compensate for the suppression that was occurring from the prednisone, and did some deep dive testing in his gut. That when he told me he went on an immunosuppressant drug and had a rapid, serious colitis, I thought to myself, this could have been a side effect of the drug, but it also could have unmasked a latent infection in his colon. And so I did some microbiome testing, and sure enough, he had a really high degree of a particular autoimmune triggering bacteria. So the medical literature has shown that infections with this particular bacteria are associated with the development of autoimmune disease. And so I treated that, and then worked with one of my colleagues and really revamped his diet. And he did beautifully, and was able to come down on the prednisone quite a bit. And then it became evident that his mindset and his kind of post-traumatic stress around his illness, and fear of recurrence and fear of not being able to find a right treatment for himself someday, was really getting in his way. And we ended up having a really deep conversation about this, how his mindset was playing an enormous role with him and his condition, and how he had the power to change that. And his mind was incredibly powerful and could have bearing on his immune system and the expression of his disease. So he took that to heart and began meditating, and also began doing breath work, and literally transformed. It was really extraordinary from one visit to the next to see someone who was visibly anxious and firing off questions and could barely listen to answers because he was just thinking about his next question, and he was just always in a state of fight or flight or fear, to then all of a sudden this really deeply peaceful and serene person who was thinking differently about his future and understanding that his life was really in his control in many ways. So he made this shift that was so incredibly instrumental and important for his health. And we have been able to successfully wean him down off the prednisone, watching his inflammatory markers, its autoimmune markers and things like that. And so far he's doing absolutely beautifully. His hair has grown back. His body composition has optimized. His gut feels good. He's ready to go back to school now. And yeah, it's been a beautiful experience working with this person.